Why does contrast dye hurt during a lung cancer court scan? Have you ever wondered why some people feel discomfort during a lung cancer court scan when contrast dye is used? It's a common question, and understanding the reasons behind this sensation can help ease any concerns. First, let's clarify that the court scan itself is usually painless. The discomfort often comes from the injection of the contrast dye, which is typically administered through a vein in the arm. When the dye is injected, some patients may experience a brief burning or stinging sensation at the injection site. This feeling is generally temporary and goes away quickly. The contrast dye used in these scans is made from iodinated compounds. These compounds can irritate the lining of the vein, leading to mild discomfort or a feeling of warmth during the injection. In rare cases, some individuals may have a mild allergic reaction to the contrast dye. This can manifest as itching or hives, and while more severe reactions are uncommon, they do requiring immediate medical attention. It's always important to inform your healthcare provider about any previous reactions to contrast agents. Another factor that can contribute to discomfort is if the contrast dye leaks outside the vein, a situation known as extravasation. This can cause pain, swelling, or inflammation at the injection site. However, skilled healthcare professionals use proper techniques to minimize this risk. Anxiety can also play a role in how we perceive pain. If a patient feels anxious about the scan or has a fear of needles, this can heighten their sensitivity to discomfort during the procedure. It's worth noting that not all lung cancer court scans requiring contrast dye. In many cases, especially when evaluating lung nodules without suspected vascular involvement, the scan can be performed without it. When contrast dye is used, it helps provide detailed images of blood vessels and tumor margins, which is crucial for accurate diagnosis and staging. Before administering contrast dye, healthcare providers will assess kidney function to ensure safety and evaluate any history of allergies. Patients should always communicate openly with their medical team about any concerns or previous experiences with contrast dye. In summary, any discomfort related to contrast dye during a lung cancer court scan is typically linked to the injection process and the properties of the dye itself. These sensations are usually mild and manageable with proper care. Always consult your healthcare provider for personalized advice and to address any questions you may have about the procedure.